Hi, Dr. Brittany from Strathroy Wagner Chiropractic Health and Wellness Centers, bringing you my case of the week. This week's case involves a patient who presented to my office with a disc herniation and associated sciatica symptoms. In a lot of these cases with disc herniations, you may have a patient present to your office like this one with a MRI report. Sometimes we have to do an assessment and we can rule in the possibility of a disc herniation, but really the gold standard to diagnose disc herniation is either an MRI or a CT. So for this patient, what I did for treatment is I started with a little bit of ultrasound to the low back area with the goal of trying to reduce some of the inflammation around that nerve. I also did some soft tissue work to the glutes, to some of the low back muscles, and then I used the activator in the low back, often because these patients can be in a lot of pain and acute and not tolerate a lot of movement through their joints. And then in the low back area, I did some drop piece work for the pelvis. And then lastly, I did some mobilizations to the hip and some stretches to the legs and ankles. I sent this patient home with some exercises to do at home. So for disc herniation patients, you can do nerve flossing, you can do some strengthening to the core, the glutes, and some light stretching to the low back and the leg area. These patients often take time. It's not common that a disc herniation patient will respond really quickly. Some of these cases can take up to 6 months or a year or even longer. Some become more chronic pain patients and you're doing more symptom management for this patient when flare-ups come up. But some patients do resolve from disc herniation type symptoms. It often just takes time.